the hidden warning signs your body is crying for help before it's too late. Your body speaks to you. It whispers, it nudges, it even shouts, but we often ignore it. You feel tired, you notice changes, but you tell yourself it's nothing. But what happens when your body is actually crying for help? What if you're overlooking subtle signs that could prevent a major health scare? By the time you realize what's going on, it could be too late. So let's uncover the hidden warning signs that your body is sending out distress signals before you wish you had listened sooner. 1. Unexpected fatigue. Let's start with something everyone experiences: fatigue. We all get tired, right? But here's the catch. If you're suddenly feeling exhausted after doing nothing more than handling your normal tasks, or even after a full night's sleep, that's not just being tired. When fatigue hits you hard out of nowhere, it could be a sign that your thyroid is off balance, that your heart might be struggling, or even that you're heading toward diabetes. Sarah, a 32-year-old mother of two, began feeling completely drained all the time. She thought it was just her busy lifestyle. After a couple of months, she went to the doctor and was diagnosed with hypothyroidism. Her thyroid was underactive, and it was making her feel sluggish and tired. With medication, she felt more energized. Prevention tip: keep track of your sleep, diet, and physical activity. Avoid excessive caffeine or sugar, and focus on a balanced lifestyle. To optimize your energy, focus on nutrient-rich foods, and make sure you're getting enough protein and healthy fats in your diet. It's also worth keeping a sleep diary to track your rest patterns. 2. Unexplained weight loss. Sudden weight loss without any effort. Sounds great, right? But before you celebrate, this could be a serious sign of underlying health issues. If you're eating the same and still losing weight, it's time to dig deeper. Conditions like hyperthyroidism, an overactive thyroid, cancer, or even diabetes could be at play. The key here is that weight loss should not happen without reason. Mark, a 50-year-old accountant, noticed he had lost 15 pounds in just a few weeks without changing his diet or exercise habits. Initially, he didn't think much of it. But after a routine checkup, doctors discovered he had early-stage type 2 diabetes. His blood sugar levels were too high, which caused his body to burn fat. Prevention tip: if you notice unexplained weight loss, track your food intake and try to maintain a healthy, balanced diet with complex carbs, lean protein, and plenty of vegetables. Stay hydrated and consult a healthcare provider to rule out any conditions, particularly if you've noticed other symptoms like thirst or increased urination. 3. Headaches that won't quit. Headaches are so common that we often shrug them off, but if they increase in intensity, are persistent, or come with symptoms like nausea or dizziness, this could indicate something serious. You may think it's just stress, but a regular, pounding headache could be a sign of high blood pressure, a brain tumor, or even an aneurysm. Amanda, a 40-year-old teacher, had been getting severe headaches, but chalked them up to work stress. When the pain intensified and she started experiencing blurred vision, she sought medical advice. After a scan, doctors discovered she had high blood pressure and migraines. With medication and lifestyle changes, she gained control over the situation. Prevention tip: monitor your stress levels and take breaks throughout your day. Use deep breathing exercises and incorporate stress-relieving activities like yoga, meditation, or journaling. Hydration is also key. Sometimes, dehydration can cause headaches. And remember, getting regular checkups for blood pressure and overall health is crucial. 4. Chronic pain that doesn't go away. Let's talk about chronic pain. This one's tricky because pain is often seen as normal as we age or after a hard workout. But what if it's not? If you're experiencing joint pain, muscle stiffness, or back pain that doesn't go away after a few days or weeks, your body could be trying to tell you something. Arthritis, fibromyalgia, and even autoimmune diseases can all present as chronic pain that doesn't have a clear cause. John, a 45-year-old runner, noticed a persistent pain in his knee that wouldn't go away, even after rest. He attributed it to running too much. After seeing a specialist, it turned out to be rheumatoid arthritis, a condition he hadn't expected. With early treatment, John was able to maintain his active lifestyle without worsening the condition. Prevention tip: if pain persists for more than a week, consider visiting a specialist. Regular stretching, strengthening exercises, and low-impact workouts like swimming or walking can often help prevent joint and muscle pain from worsening. And don't ignore warning signs. Early treatment can significantly improve your quality of life. 5. Mental fog and forgetfulness. How often do you experience that mental fog, where you can't focus or you forget things easily? Forgetfulness is common, especially with stress or busy schedules, but if it's happening more frequently, it might point to something deeper. You might be dealing with early-stage dementia, sleep deprivation, or even depression. Mental fog can also be a side effect of nutrient deficiencies, like vitamin B12 or vitamin D. Carla, a 30-year-old marketer, noticed she was forgetting simple things, where she placed her keys, important meetings, and even conversations. It started affecting her performance at work. After testing, she was diagnosed with vitamin B12 deficiency. After taking supplements and adjusting her diet, the fog cleared. Prevention tip: sleep is key for memory and focus. Aim for 7 to 9 hours of sleep each night and avoid screens before bed. If you're still feeling mentally foggy, talk to a professional about possible deficiencies and eat foods rich in omega-3 fatty acids and vitamins to help keep your brain sharp. 6. Skin changes. Look at your skin. Really look. Is it dry, itchy, or irritated? Changes in your skin could signal autoimmune diseases, hormonal imbalances, or even skin cancer. If you've noticed an increase in rashes, unexplained moles, or dry patches, don't wait for it to go away on its own. Conditions like psoriasis, eczema, or liver issues can all cause these symptoms. And when it comes to moles or spots that look different, don't risk it. Rachel noticed a mole on her arm had changed in color and size. She thought it was nothing, but her husband urged her to get it checked. After a biopsy, doctors confirmed it was melanoma. Fortunately, it was caught early, and she underwent treatment to remove it. Prevention tip: protect your skin from harsh sun exposure by using sunscreen, and be mindful of any changes. Check your skin regularly for any new or changing moles. If you see anything suspicious, have it checked out immediately by a dermatologist. 7. Swollen joints or feet. Swollen joints or feet can be a sign of arthritis or other chronic conditions. But if this is accompanied by pain, redness, or heat, it could be a sign of rheumatoid arthritis, gout, or even a blood clot. Many people ignore this thinking it's just a part of aging or stress, but persistent swelling is not something to shrug off. Timothy, 60, was experiencing swelling in his feet and ankles after long days of walking. He thought it was normal because of his age. However, when the swelling got worse, he went to the doctor and was diagnosed with gout, a form of arthritis caused by high uric acid levels in the blood. Early treatment helped him manage the condition. Prevention tip: regular movement is essential for joint health. Stretch, strengthen, and engage in low-impact exercises like walking or swimming to keep the joints flexible. If swelling persists, elevate your legs and consult a healthcare professional. 8. Shortness of breath. If you feel out of breath after a short walk or climbing a few stairs, this is not just a sign of poor fitness. Shortness of breath can indicate heart disease, lung issues, or even anxiety. If it happens suddenly or feels worse than usual, it might be a symptom of congestive heart failure, asthma, or even a pulmonary embolism. Grace, a 35-year-old teacher, was always active, but suddenly began feeling winded after walking up a flight of stairs. After a series of tests, she was diagnosed with asthma. Now, with a proper treatment plan, she can manage her breathing and stay active. Prevention tip: stay active, maintain a healthy weight, and keep your heart healthy with regular cardiovascular exercise. If you feel breathless unexpectedly or more frequently, consult a doctor for a comprehensive checkup. 9. Frequent urination. Going to the bathroom often, especially at night, isn't just a normal part of aging. It could indicate diabetes, bladder issues, or even a UTI. If your kidneys or bladder aren't functioning properly, it can cause frequent and urgent trips to the restroom. Don't just brush it off as getting older. It's time to take action before it gets worse. Linda, a 45-year-old woman, found herself waking up multiple times a night to use the bathroom. After getting tested, she found out she had type 2 diabetes, which caused her kidneys to work overtime. With medication, she was able to manage her condition and sleep more soundly. Prevention tip: stay hydrated, but avoid excessive caffeine and alcohol, which can irritate the bladder. Consider reducing your fluid intake in the evening, and if you notice frequent urination, schedule a doctor's appointment to assess your kidney function. 10. Changes in sleep patterns. Finally, let's talk about sleep. If you're struggling to fall asleep, staying awake all night, or waking up way too early, something's off. Sleep is essential for your body's repair and rejuvenation. If you're missing quality rest, you could be risking insomnia, sleep apnea, or mental health issues like depression or anxiety. Jake, a 28-year-old engineer, found himself waking up several times a night, gasping for air. He thought it was stress, but after a sleep study, he was diagnosed with sleep apnea. With a CPAP machine, he regained healthy sleep patterns and felt more energized. Prevention tip: create a consistent sleep schedule, avoid screens before bed, and ensure your bedroom is a peaceful, relaxing environment. If sleep issues persist, speak with a healthcare provider for a potential diagnosis. When your body speaks, listen, because the price of ignoring it can be high. These symptoms might seem minor now, but they could lead to major health problems later. If any of these signs sound familiar, it's time to take action. Don't wait for the red flags to become a flashing emergency light. If you found this video helpful, hit that subscribe button and let's dig deeper into how you can stay ahead of your health. We've got plenty more coming, so don't miss out.